And we are live. Welcome. This is Dr. Sara Merritt with Lifestream Health Center. We're located in Bowie, Maryland. We're working to make pain management more patient-centric, caring, accessible, and evidence-based. We love our patients, and we're taking new patients. Please come see us. You can call us at 301-860-0305 or reach out on our website. I am here to bring education to folks that struggle with chronic pain and really want to help people learn more about how they can live life better or work through struggles that they have with chronic pain. Those are really patients that I think we're really able to make an impact with, and I appreciate being able to bring expertise to you. So I have my friend, Dr. Sara Ionescu, who is a physician and interestingly has had her own struggles with pain. And so I'm excited to have her here. And I think she has a lot of wisdom because she's actually, works through some things in her life that I think we can share.
Yeah, absolutely. Thanks so much for having me.
Yeah, glad to have you be here. Well, tell us a little bit about who you are and what you do. I understand, I know that you trained in family medicine, but tell us more about your practice and what you're up to.
Yeah. So, yep, I'm family medicine trained. I have 4 little kids, and about 15 months ago, I decided to kind of make a career change and decided to stay at home for a while. So, I've been home taking care of the kids. And then about a few months ago, I started to do a lot of thinking about my exercise journey and kind of where I've come from. So, I was a competitive athlete, and then when I went to med school and got married and started having kids, kind of fell off the exercise path just because of timing and because of some definitions of exercise when you're an athlete. And you can't really do that as much when you're a parent and a spouse and all of these things. And so then I kind of figured out ways for myself to be consistent.
Mm-hmm.
And when I started thinking about my next steps moving forward, I thought I'm going to just get online and start posting some things about exercise and just see where it goes. Because I'm super passionate about movement and how that can help your body physically, but also mentally. And so that's kind of where I'm at now, is just on social media, talking about this stuff, talking about the things that I've learned that have been effective for me and trying to help, relay that to people that need help with that. And I've done that, in the physician space with my patients.
Yeah.
And it's been very helpful. And so just kind of continuing that on a broader level.
That's awesome. Well, I think it's so informative because I think, we've all dealt with pain at some level, right? Just as humans. But right, if I'm honest, like I haven't had spine surgery, I just can't relate to a patient in that exact way. I think I'm pretty informed, but it's not exactly the same. It's a different perspective. And so I think obviously you've been through your own journey. Tell me a little bit, what was your sport, or what were you, what did you train in the past when you were an athlete?
So I was a swimmer, and I started swimming when I was probably about 5 years old, and then I swam all through college.
Wow.
And so then really everything was prescribed by a coach. Like I never had to think about what to do. And then when I graduated from college, it was like, oh, now I'm supposed to figure out how to do this myself. And what do I do? And how do I create a workout? And what workouts do I want to, so it just was this whole complicated scenario. And then I had it sorted out, but then I decided to quit my job that I had at the time and go to med school, which threw a whole other piece of the journey in there. Yeah.
Oh yeah. Oh my gosh. Well, yeah, and I've heard similar from patients or acquaintances, maybe who's also have maybe had a military career, that right, like if you're in that training environment, at some point this is just part of what you do, but then if you leave that environment, then things may change a lot.
Right. Absolutely.
Yeah. And so then you got to a space where you got to create your own workouts, and then did you have an injury during school, or was it before that or after that?
So I actually had an injury when it was early in college. I think I was a freshman in college. I was a lifeguard,
Mhm.
And so over the summer, I was a lifeguard, and I was climbing the ladder of our lifeguard towers, which our
Mhm.
towers were like 12 feet in the air,
Mm.
and I was carrying something, so I was only using one hand. Well, anyway, I fell backwards off the ladder and landed on the sand.
Oh,
And
wow.
in the moment, the only thing that really seemed to happen was, I got the wind knocked out of me. It took me a few minutes to recover, but I otherwise felt fine, didn't really think anything of it, and just went back to life as usual.
Yeah.
And then fast forward another year of college, I gained probably 20 to 30 pounds. And then I started having all of these issues. I started having low back pain. I started having numbness and tingling into one of my legs. I was studying for the MCAT at the time. So I was doing a lot of sitting. And I was finding that when I was in the same position for a long time, and then when I tried to get up, I was having weakness in my leg. Like I really felt like I couldn't move it that well. And
Hmm.
this went on for months because I was an athlete and I was in college, and it was like, whatever, it'll just get better. Well, it ended up being that I had a herniated disc in my low back, which is where the disc kind of pops out of where it's supposed to be, and it's pressing on the nerves, which was causing all those symptoms. And so ultimately, I ended up having surgery to correct that. But because I was a student and an athlete, and I had the surgery done at home, which was
Mhm.
not exactly where I was in college, I didn't really do a formal physical therapy recovery type thing. It was just kind of like, oh, here's some exercises to do, like work with your swim coach, whatever.
Wow. And they
Yeah.
probably give you the benefit of the doubt, like, "Hey, you're an athlete, you should
Yeah,
know what to do," whereas
exactly.
there's
Yeah.
a different perspective where, "Well, actually, I mostly do what's prescribed to me."
Right, exactly. And so anyway, so I think because I was young and my body was resilient, it was fine, and I ended up losing weight, and that was fine. But then when I stopped being as active, it started to become more of a nuisance. It wasn't incapacitating, but it was bothersome, and the pain would be bad some days. And then throw in pregnancies and the weight fluctuations with that.
Yeah.
It was like, I need to do something this needs to be resolved. And I, on my own, kind of came up with a plan that involved movement and stretching and deep core exercises, and essentially was able to completely resolve all of the issues I had with doing stretching and exercise.
Wow. And so what type of stretching or what kind of resources did you use to find a stretching regimen? Was it a matter of just like, this feels good, so I should do more of it? Did you need to do some research to find out what there's data for? How did you explore that?
Yeah, so it was a little bit of a combination of both. I actually, the way that I really started figuring it out is I had pelvic floor issues after
Mm,
my second delivery.
yeah.
And my OB was wonderful. And I also had a huge diastasis recti. And she said, you need to go to PT because you need
Mhm.
to correct both of these issues, especially if you ever want to have any more kids. And so
And
I
for that
did.
diastasis recti, if you're listening and you're not sure, that's a separation in the abdominal muscles where they've just been spread very far apart and by pregnancy.
Yes. And so the physical therapist that I ended up working with, of course, asked all about my history. And when she
Mm,
found out about this injury and the pain I'd been having, and she said, I think that a lot of this stuff is going to be really helpful for your spine also.
mm, mhm,
And she was absolutely right because the focus was on, of course, pelvic floor, but then on deep core and strengthening,
mhm,
that innermost layer of your abdominal muscles, which is important to help close the issue that I had from pregnancy, but it
mhm,
also helps strengthen and support your spine.
mhm,
And what I noticed during all of that physical therapy was I was having much less back pain. And
mm,
so then I was like, oh, I'm going to keep doing this stuff. And then after I completed that physical therapy, I started doing my own research, and I found some of my own exercises that I like to do and the stretches that I like to do, and it just kind of became part of my everyday to do it every single day. And that has made a huge difference in terms of, basically resolving my pain, like I said.
yeah. Yeah, so you developed kind of what you do in collaboration with your therapist and then in just seeing the results it's given you.
Yes, exactly.
Yeah. And that's been, I mean, bigger than diet for you. I mean, it sounds like it's really been the movement is a game changer.
Yeah, for me, it definitely was. I mean, my weight definitely played into it because I had less pain and less intense pain when my weight was not at a pregnancy level or where I had gained weight in college. But even when I was at like a good weight for my body,
Yeah.
if I wasn't moving, I still had pain. It was really the movement that and the stretching, I think, that helped with mobility and helped with
Mhm.
low back strength and core strength that allowed me to function in a better way day to day.
Yes, and I think we were talking kind of before we got started. There's a concept that people may or may not have be familiar with already, which is that maybe movement is medicine, and that in fact, the body is made to move. What I'll often tell a patient in a patient visit is really that the body is like a use it or lose it kind of thing. That
Yep.
and the risk of someone becoming, very inactive, because very often I work with patients who've had injuries and they have significant pain, and it can engender a lot of fear to move. But we've got to find ways to look at movement as medicine and understand that it can help us um, feel better.
Yeah, absolutely. And that's part of why I started was really part of my passion to get started on social media because I had so many patients where they had been told by someone that the guideline is 150 minutes a week of moderately vigorous exercise or, 5 days, 30 minutes at a time. And they were like, I just cannot, like, I'm not moving at all. I have
Yeah.
no idea how I would ever do that. And so I would always say, can you find 1 minute a day? Like just one. And if you're moving 0 minutes and then you move 1 minute, like that's huge. That's an
It's
improvement.
progress. Yes.
Yeah. And I
Yes.
think, many of the patients that I started talking to about this, they would come back 4 weeks later and say, once I was up and moving for a minute, doc, I honestly felt silly sitting down. So I just kept going. Those things
Yeah.
would happen where it was like, if it's nothing too intense and you're not having any crazy symptoms, like maybe you can up it and you do 2 minutes or you do 1 minute a few times a day. And even if it feels like a little by little amounts to a lot. And you can start to see huge improvements when you're consistent with that.
Yes. Yes. I think that's awesome. Yeah. And I think, not to I think you're right on the way that I like to think about it too, that if you can um, just do that little bit, and it doesn't even have to be like, hey, you need to go run a marathon. It's really just work within like what you can do, and then eventually that what you can do gets bigger if you can work, toward that edge, but you don't have to go past it necessarily, to
Right.
still be making progress.
Absolutely. Yeah.
Yeah. That's great. And what is your exercise routine or your movement routine? Maybe we should call it. What does your movement routine look like currently? Or and maybe current's really good, and here's what I need for a day to day basis, and here's my ideal. Right? They might be two different things.
Yeah, so I move every day. I have 4 kids that are 6 and under. So
Yeah.
inherently my life is mobile because they
Oh
do not stop unless they're sleeping. So that's kind of built into my everyday, but I also really need and crave intentional exercise and movement as well.
yeah. Mhm.
Of course, in the phase of life that you're in, it just depends the amount of time you can find. And there are days where, I do run. So I am a runner and I will do, a warm up, a run, a cool down, a stretch, the whole shebang. And then there are days where that just doesn't fit in. But like I sort of alluded to before, I always at least find a few minutes to stretch and do some deep core exercises. And those are the more, active recovery type days. And then I will admit I want to do more strength training. I sprinkle it in because I that is also hugely important for your body, especially as you age.
Mhm.
But of course, again, it's a give yourself grace kind of thing. You do what you can do with where you're at. I think the biggest thing is not having a set definition, and then if you don't meet that, not doing anything. Because that's where I was, where when I wasn't an athlete anymore, but I couldn't exercise like an athlete, I just said, well, I'm not going to exercise at all. And
Mhm.
that's not helpful for your body or for your mindset or anything. And so I think kind of reframing that and saying,
Yeah.
like, okay, I can't do 30 minutes or I can't do 45 minutes, but I can do 5 or 10. And here's what I'm going to do. And I'm going to write it down and say, great work, self, like you're doing it every day.
Yeah. Yeah. So did you find that logging it was impactful for your seeing
Yes,
progress yourself? Yeah.
absolutely.
And so like if you do the lower version, just the bare minimum, you can get it done in what, 10 minutes or longer than
Oh,
that?
even less. I mean, there are days where like if a kid wakes up early because they're sick or whatever, like I'll do 3 minutes of stretching and 2 minutes of
Mhm.
deep core. I mean, I do, and it's again, it's like telling those patients, you did a minute, it counts. It took me a really long time to get there to feel like, yay, I'm doing a good job with only doing 5 minutes, but
Yeah.
it makes a difference for me doing 0 versus doing those 5 minutes, because on the days where it just doesn't work and I do 0, I notice a difference both in
Mhm.
my body and how I move, but also in my mindset and how I can deal with things that come up during the day. And that's, I mean, those are like the bare minimum days. Usually I can find more time than that, but that
Mhm.
I can get what I need to get done for my body in that amount of time.
Yeah, I think that's just awesome and really impactful that again that you know 5 minutes of intentional movement can make a real difference for so many of us, and that consistency. Look, 5 minutes at a time over a month is like several hours.
Right.
You're going to be at two
Yeah.
hours plus by the time you really do that on the daily, and much less if you actually have some times that you open up to more.
Yeah. And I think that, for me, it's really about the doing it every day part, because I find
Mhm.
if I skip a day, I it's like that much harder, that much more of a barrier the next day to get back into it. And if you're doing something low impact like stretching, doing it every day, obviously you're not going to go run miles and miles every single day because you have to give your body recovery time. But things like stretching and deep core, I mean, those are things that you can do safely every day and build up that consistency, and then you can progress to longer intervals and more intense type workouts.
Awesome. Well, and actually, maybe this would be a segue to maybe touch on just general health benefits of regular exercise or stretching, and mental health benefits, of course, too, which I think you sort of touched on. But I think again, for as I see it, for a lot of the patients that I work with, if they have significant pain, just that idea of movement is daunting. So um, all the reasons to do it can be impactful, and really just educating us further on how it can be impactful for our general health, I think is really just worth sharing. I think this, I know this, maybe everybody knows this, but let's revisit it.
Yeah, I mean, I think, of course, the thing that always comes top of mind is, obesity is something that's a major problem in our world today. And so any movement is helpful in the goal of, if you are in that zone, to help reduce your weight. I
Mhm.
think this is also hugely important for families, like for kids, because if
Mhm.
you instill in children the importance of movement just for their overall health, to
Mhm.
maintain a normal weight, for their mental health, and I'll go into that. But I think starting that at an early age is unbelievably helpful, because when you build those habits in, it's almost ingrained in them that they want to keep doing that. Whereas when you're starting from adult, it's possible, it's totally doable, but it is more challenging than when you had built that in, as a child. Of course, everybody, I mean, like you said, we probably all know, but things like your heart health, your muscle health, all of that, as you age, the more you are moving, the better those things will be as you get older. And especially, I think, when you think of getting into your 80s and your 90s, if you're not moving around in your 40s and 50s, it's going to be a challenge when you get into those higher decades. And so starting yourself off with that movement when you're younger will help that aging process be a little bit more graceful in terms of the pain that you have and things like developing osteoporosis and heart disease and all of that. But I think, like you mentioned, I think the thing that is least talked about, but is so hugely important, is the benefit that it has on mental health.
Hmm.
Because I have seen it so many times with patients, and you can carry, an official diagnosis like depression or anxiety. But
Hmm.
even for people that maybe don't meet the criteria to be diagnosed with these things,
Yeah.
it still makes a huge difference on your mental health. It is, there's science behind it. I have lived it myself. Like when you compare days that you're not moving to moving, it's just wild when you start to pay attention to that and think about it. And I've seen these transformations in patients that were not moving much. And
Hmm.
then they start moving and they come in, and you're like, oh my God, it's like you unearth this whole other person that was underneath the
Yeah.
person that they were when you first met them. And, that's why I think it's so important, because yes, the weight part is important, and yes, all the other stuff. But I think if you can be in the right mindset, that
Hmm.
just helps everything else about your body and about your life. And so, yeah, I mean, the benefits with mental health are enormous.
Yes. Yes. I've definitely seen people very regularly voice, if I'm seeing someone who's having challenges with chronic pain, very often they're, frustrated that they're not able to go and do things. But you're right, it does translate into mood, and we know that people with chronic pain have a higher incidence of depression. Even if you didn't have depression prior to having a significant painful episode, you're much more likely to actually be diagnosed with it.
Right.
And we know that exercise, 20 or 30 minutes a day. I think the data is around like 3 days or more a week, and not even quite as high as that 150-minute threshold. But even at that level, that for many patients, that type of dose of exercise works as well as an antidepressant.
Yeah.
But to your point, it may have to start with 5 minutes.
Right. And you just build up from there. And that's okay. That's okay. You don't like, you may not be where your neighbor is or where whoever is, but
Mhm.
you can get there too. You just have to build it, and build it in a way that's sustainable for you.
Mhm. And did you end up having a spine surgery, or did
Yes,
you? Yeah.
I did. Yep. I had a surgery to correct that.
Wow. Wow. And how was your recovery from that?
So I mean, it was now that I'm a physician, I'm a primary care doctor, obviously, but I'm not sure that knowing what I know now, that I would have done it, because I really
Mhm.
hadn't tried much before we just said, okay, let's do it.
Yeah.
But that being said, I think because I was young and relatively fit at the time,
Yeah.
even though I did not do a formal physical therapy program, the recovery was fine. And actually, it felt like I was in so much pain by the time I got to the surgery. Like
Yeah.
when I woke up, it was like a miracle. It was like, oh my gosh, like
Way better
everything
already.
felt instantly better. And I could walk and run and like do all the things that I was limited in before. So now that
Wonderful.
I'm saying that, I'm like talking myself back into having it again. But
Maybe
yeah,
I
it
did do
was,
that. Yeah.
yeah, maybe right. Like I'm not sure that I could have done anything else that would have
Yeah.
corrected it, because the surgeon that I had was like, this is one of the worst that I've ever seen in
Yeah.
somebody this young. But so yeah, I mean, it was remarkable. When I woke up,
Big
it was
change
like,
right away.
let's go. And they were like, whoa, whoa, whoa. Like you can't you can't go straight to running a 5K. But I was able to get back to my normal activities very quickly.
Okay. Well, that's great. That's amazing. Yeah. Yeah. And the right surgery can be like
Yeah.
that.
Yeah.
The right surgery can be like that, can be really impactful. And also that, but you had that problem for maybe a year before that surgery happened. Is that right?
Oh, yeah, probably. I mean, I had started
Escalated
having
to
it, yeah, and it progressed because I kept gaining weight, and then like it was the off season of swim, and so I wasn't exercising really at all because of the pain, and so then the weight gain sort of accelerated, and yeah, it just turned into this, like the symptoms rapidly got worse. And it
Mhm.
was literally the day that I took the MCAT, I was hobbling to the car. Like my dad picked me up and he was like, okay, I think it's time we go get somebody to look at this because you
Yeah.
can't even bear weight on your leg. You're so
Right.
like, it was so numb and weak. And then, yeah, so then it just spiraled into all of that. And
Yeah.
luckily it all worked. Thankfully, everything worked out.
It was time. Yeah. It was
Yeah.
time. Wow. Yeah. No, that's a big, obviously a big thing to go through. Um, yeah, and I think so many patients that I talk to, we often work with patients who are having or have had spine surgery, and that's really the outcome usually people are hoping for. Frankly, is to get a surgery and feel much better right afterward. And I think it's interesting that obviously your problem had progressed to such a degree that that even despite it not being a new problem, that you really had a big degree of relief right afterward. That's great.
Yeah.
Um, I had a patient lately, as you're talking about, movement and being encouraged to move. I had a patient lately who had an episode where this is somebody that I see for low back pain and sciatica. She's had an epidural with me recently, which is a type of injection for, steroid and numbing medicine. She's not a candidate for surgery. And so the injections are something that we've done from time to time. And then she had an episode where her pain was worse, and she had spoken with a member of her family who actually had advised her to do bed rest, and like, well, if you're feeling worse, you should just rest and like let it get better. You're a clinician and you're someone who's dealt with pain problems. There was a time in the 80s that we advise people to have bed rest after a back injury. Nowadays, not so much. Tell me about from your personal experience. Do you advise people to do bed rest, or is there a scenario that would be a good idea?
Yeah. So off the top of my head, I can't think of a scenario where, in a situation like that where it would be a good idea. From my personal experience, I mean, as an example, after one of my deliveries, they wouldn't let me get out of bed because I was feeling very dizzy from some of the medicine that I had received. And I was like, you don't understand. Like, my back is hurting so much right now. I need to just like get up and walk around. And they, like, finally, we sorted it out with assists and my husband, we got it all
Yeah.
safely to be able to do it. But for me, if I'm in the same position, whether it's standing and not moving or sitting or laying and not moving, I mean, that's where things really start to become bothersome. And sometimes, and I think maybe this is where patients develop that fear of it hurts. But for me, like a lot of times, that first minute or two, when you get back to trying to move, the
Mhm.
pain is there. And it's not that it's worse, but it's just like, oh gosh, now that I'm trying to move, this feels miserable.
Yes.
But if you can get through that first minute or two, inevitably things start to loosen up. And if you stretch it
Mhm.
out, like it will feel better. And
Mhm.
I had days where, like, when I would get out of bed in the morning, it was so painful, I couldn't stand up straight. And I would just do like get on the floor and do child's pose, which is a yoga pose. If anybody does yoga, where you're on the floor, kind of stretching out your back. I would do cat cow, which is another yoga thing where you kind of flex and
Mhm.
extend your low back from an all fours position. But I mean, there were days like going into residency call where I would be stretching so that I could stand up straight to go to work because I wasn't exercising like I wanted to and I had this pain. So, I think that the movement piece for me specifically was huge. And I think bed rest, there are, of course, certain specific situations, but I don't
Sure.
think there are a lot in the musculoskeletal realm, aside from
Short of
fracture.
a fracture. Yeah.
Right. Yeah,
Right.
like fracture where you can't bear weight, but there are a few, but I think in general, movement is medicine, like you said, and it really
Yeah.
helps.
Yeah, and I think that's really great that you can share all this firsthand experience, really, because it's easy to say, um, it's easy to say like, oh, well, you should move more, and I think patients, it can be hard to hear, like,
Right.
but it
Well,
hurts,
it's like, you don't know how I feel, so
and you don't know
why do you why do you get to tell me that you don't know what the pain that I feel? Yeah.
how. No, that's right. That's right. And yeah, I think just really acknowledging those little changes and going from zero movement to, I did 60 seconds, or I did 2 intervals of 60 seconds of doing something is really worthwhile, and is a big win
Yeah.
for a lot of folks.
Yes, absolutely.
Yeah. Yeah. Well, thank you so much, Dr. Sara Ionescu.
Yeah.
Is there anything else that you want to leave us with? Any other topics we need to discuss today?
I would just say to just get started, to not wait for it being the right time or the perfect time, to just, again, if you're not moving at all and you have pain, just try it out. Like, just get out there. Don't, sit with the fear, but then keep going anyway. Because I think that sometimes it's really easy to just say, like, oh, I'm just going to wait for this or wait for that, but then whatever you're waiting for doesn't happen, and now
Mm-hmm.
all this time is going by where you're not moving and things are happening to your body, and you're losing that time. And that's what, when I finally sat down, it was like, oh my gosh, like, I'm losing all these days and months and years to work on being healthy when my kids are small. And that for me is what was like, okay, we got to get the ball rolling. Like, it doesn't matter how messy it is, how not perfect it is, just do it. And I think that's what I always tried to tell my patients, is it doesn't have to be perfect. It's not going to look like
Yeah.
what everyone else is doing, but just compare yourself to what you were doing yesterday. And that's all that matters.
Yeah. And it doesn't sound like it really required an expensive gym membership or a
No,
personal trainer, or
no,
some
not
physical
initially.
therapy, but
No,
not a ton of formal physical therapy even.
no, nope.
Yeah, I think that's amazing. Yeah, mindset, movement, all this. Well, I think this is so beneficial, and I really, really thank you for just really helping people acknowledge and own, like, 3 to 5 minutes of exercise is impactful, right?
Yeah,
Because it is, and anyone who doesn't think that it is hasn't ever been in a position to know how hard that 3 to 5 minutes can be, right?
exactly. Yeah, absolutely.
Yeah, that we just have to, like, go forward from where we are and do a little something and go from there. So yeah, I really thank you. So I think for anybody watching where that message speaks to you, I really encourage you to check out Dr. Sara Ionescu. I've reproduced some of her links here for Facebook, LinkedIn, Instagram, etc., and her webpage. So if you want to learn more about how movement is medicine, how exercise and stretching can help your general health and chronic pain, please follow Dr. Sara. And we appreciate her being here.
Yeah,
All right.
absolutely.
And with that, I'm Sarah Merritt with Lifestream Health Center. We are located in Bowie, Maryland. Please find us at lifestreamhealth.com. Thank you. Bye.
Bye.